Hello class. So today for the first skill that we're going to do is that we're going to focus on mouth care. Okay, so for this skill we're going to go ahead and there's a couple of supplies you'll need. You need a box of gloves, you'll need a toothbrush for the mouth care procedure, and you will be brushing your person's actual teeth. You'll need a supply of toothpaste, and you'll also need a cup. This cup is primarily for water. You want to go ahead and fill that with water, because and you can actually fill the cup of water before you actually do the skill. That way you already be prepared, but this is primarily to help the person rinse their mouth, and it can also be used to wet your toothbrush at the beginning of the skill. You'll also need an emesis basin for the person to spit. Of course, if you look at the shape of this emesis basin, it makes sense that this part will go against the person's chin so that they're able to spit into the basin. And finally, what the book refers to as your drape, you'll use a towel for your drape. So I'm just going to go ahead and I'm going to demonstrate this skill. You guys are more than happy, or more than welcome rather, to follow along in the book with the steps. I just want to kind of speed things up, make sure you have a good understanding of how to be able to perform the skill. Okay? So for this skill, we're going to go ahead and I'm going to pretend as though I'm going into the patient's room after the fact that I fill this cup with water. So I fill the cup with water. Now I'm going to go ahead and get ready to go into the patient's room. Knock, knock. Good morning, Mr. Jones. My name is Doris. I'm going to be your CNA today, and I'm going to assist you with mouth care, if that's okay. That's fine? Okay, we'll go ahead and proceed. I'm going to go ahead and I'm going to remove your call bell. Okay, we won't need that until a little bit after. And I'm going to get my table set up. Okay. So with your table, you guys, you're going to have everything with you and have it in a decent order. Okay. You can go ahead and we're going to get ready to provide privacy. We're going to go ahead and sanitize as well after we provided privacy. I'm going to raise the head of the bed at least 75 to 90 degrees. That way the person doesn't have a risk of aspirating. Like we mentioned before in the lecture, if you have someone that's comatose and you have to provide oral care, you want to make sure that that person is lying on their side position in case, so we don't want them to aspirate, and in case secretions drain out of their mouth, we don't want them to choke on those secretions there. The next thing that I'm going to do is that I'm going to go ahead, I'm going to put on my gloves, okay? When you're putting your gloves on, make sure that you're putting your gloves on with care. Don't just pop them on your hands. You want to be careful the way you handle your gloves, okay? Because sometimes, depending on the setting, the gloves may be a bit more fragile. You're going to take your drape and you're going to place it on the person's chest. You're going to place this on your chest for a minute. You can also feel free, these are clean gloves. I can also adjust my bed, the height of my bed a little bit more. It's just whatever suits you most. So I'm going to go ahead and raise the height of the bed so that I'm not more so bending at the waist or the back, okay? All right, that's high enough. Now, I've sanitized, I have my bed in position, I have my drape. I have my cup of water. Remember, this is already pre-filled with water. I have my toothpaste and I have my toothbrush, okay? The first thing your skill says, it says that we need to wet the toothbrush. How you do this to save you a trip when walking to the sink, you'll take the cup of water that you have here and you'll pour a small amount, just enough to wet that toothbrush. Next, you're going to take your toothpaste, you're going to take it, and you're going to only put a pea-sized amount on the toothbrush. Makes sense, huh? Lay this down. You're going to go ahead and you're going to begin the process of brushing. Now, whenever you're brushing the person's teeth, okay, you're going to want to make sure you're brushing from side to side, both sides. You want to make sure you're brushing the bottom, the top. You want to get the back teeth on both sides. You want to make sure that you're cleaning all surfaces of that resident's teeth. You also want to make sure you get the roof of the mouth. And most importantly, you want to make sure you let your observer know that you're brushing the tongue. Okay? You can offer the person to spit if they need to between. So we're going to go ahead and ask him to spit. Okay? He does that. Immediately after he spits, we want to go ahead and pat his mouth off. Okay? Now, I hold on to my toothbrush. I'm going to give him a little bit of water. And I'm going to ask him, can you swish around in your mouth? He's swishing it around his mouth because we want him to spit it out. Go ahead and spit out those contents. Well, as soon as he spits out the contents, I can put my emesis basin back on the table and proceed to dry his mouth off. Okay? Now, if you note, this toothbrush is still in my hand because we have to make sure that we're handling all the necessary supplies in a decent order. I remove the drape. Okay? Now, I'm going to immediately go ahead and gather my equipment, but my toothbrush is still separate. Okay, toothpaste. I have my spit cup. I have my emesis basin, and I have my gloves. I'll be right back. You're gonna leave out of the room. You're gonna go ahead and you're gonna place your towel in your soiled laundry. You're gonna go ahead at this point and you're going to place your gloves back. You're gonna throw this cup, it goes in the trash. The emesis basin and as well as the toothpaste goes on your storage table. The emesis basin and the toothbrush, we still have things we need to do with that. So I'm gonna turn the camera just a little bit so that you'll be able to see me there. Okay. We want to make sure that we're taking this emesis basin. It has to go to the sink because we have to rinse it out and dry it out, and also pay attention to the way in which we handle our toothbrush and rinse it out. So just this, so I'm going to go to my sink and I'm going to empty out my basin, turn the water on, not too high, rinse it out, take a paper towel, and I'll proceed to dry my basin out, dry it out, make sure it's fully dry. Throw that away. Toothbrush, same thing. Rinse it off really good. And also, it wouldn't hurt to dry it off as well. Okay? That shows that we are being very studious with how we keep this person's toothbrush. At that point, it is safe. You can't go ahead and place your toothbrush back into your emesis basin because it's dry and it's cleaned out. At that point, you place your supplies on your storage area. I'm going to go ahead and turn you back so we can finish setting up the room. Okay? I'm back in the room now. Now it's time for me to get ready to clean up and prepare the patient back to a normal position. I can go ahead at this point and I can remove my gloves, pinching in the center and taking the two fingers to remove the glove, and I throw them away. Okay? At that point, I can go ahead and I can situate my bed a little bit farther. I'm going to lower him back down, but I wouldn't lower him just too flat. Just lower him back down. About a good, let's say 45 degrees. Okay, there. I also want to lower my bed since I did choose to raise the height. At the same time, I want to place the call bell in his hand so that it's easily accessible to him and let him know that call me if you need anything. I'm going to sanitize my hands for this procedure, and I'm going to place my bedside table back at the bottom of the bed. Checking back to make sure that all of my items in the room are nice and neat. And I'm going to tell the person skill complete. That is the end of the mouth care skill.